Hello, my name is Desmond Jensen.
And I'm Joelle Lester. We're staff attorneys with the Tobacco Control Legal Consortium, a program of the Public Health Law Center. We support tobacco control professionals and advocates around the country as they work to implement policies to protect health at the local, state, and federal level. Today we want to talk a little bit about an FDA action that fails to uphold the Tobacco Control Act and puts tobacco industry interests ahead of public health.
Before we get to the FDA's action, a little bit of background information might be helpful. As you know, until the Tobacco Control Act was passed in 2009, tobacco companies could introduce and sell new products whenever they wanted without any government oversight. This has led to a steady increase in the addictiveness and attractiveness of tobacco products over the last 50 years. Some products on the market now are actually far more deadly than products were years ago.
Under the Act, new tobacco products have to be authorized by the agency before they are introduced to the market. And when using this authority, Congress made the protection of public health the agency's guiding principle. Every action that the agency takes should be a step towards decreasing tobacco use and the related health harms.
The process for authorizing the sale of new tobacco products is fairly simple if you strip out all the jargon. A tobacco product manufacturer submits an application for a new product to the FDA. FDA scientists analyze the information and determine whether or not the product can be sold. Under the law, the FDA must authorize a new product before it can be marketed. This must be done for a brand new product or a product that's slightly modified.
At least that's the way it's supposed to work. Unfortunately, that's not what's happening. Tobacco product manufacturers are continuing to market new and modified products without the required authorization. And then a few weeks ago, the FDA introduced a new guidance document saying that's okay if the tobacco product manufacturers continue to market those products. And those products can stay on the market as long as a certain application process is followed. So in other words, the FDA has said it's okay for the tobacco product manufacturers to illegally market their products.
Even more troubling, the FDA is going to open the door to allow some new products to be marketed without any federal oversight. The agency is telling tobacco companies that if they file a specific type of new product application, the FDA will allow the product to be sold right now in 2015 before the agency authorizes the sale. Eventually, these products could be removed from the market, but only after years of being purchased by consumers.
We believe it's important to support the FDA in its regulation of tobacco products because federal authority to restrict tobacco has enormous potential to reduce the catastrophic health harms of tobacco use in our country. However, when the FDA allows the tobacco industry to skirt the law and takes an action that places industry interests above public health, the public health community has to push back.
We've directly questioned the FDA about this policy and challenged its decision to take this action. Nothing we have heard from the agency staff has changed our view that there is no basis in the law or the public health standard for this action. We hope that you will join us in telling the agency that the public health community finds this practice unacceptable. The FDA should be acting to protect public health. You can help us send this message by submitting a comment to the FDA expressing your concerns.
We've included a link to the FDA's docket for public comments on this page, as well as more details about the agency's proposed action. Add your voice to ours as we tell the FDA that this action is not okay and they can't place industry interests ahead of public health. As always, if you have any questions, please feel free to contact us by phone or email.
Thanks for your time.